So many people missed the one and only Texas gubernatorial debate on a recent Friday night in high school football season. No wonder. Since I was there, though, I live tweeted it. One tweet blew up across the state and the country, even a continent away. It was the one about Beto O'Rourke criticizing Governor Greg Abbott's decision not to expand Medicaid. O'Rourke said he would so that Texas could stop missing out on billions of dollars from the federal government every year. Medicaid was expanded in 2014 by the Affordable Care Act, or Obamacare, so that more low-income people could have health coverage. Well, at first, the federal government paid 100% of the cost for that. Then that dropped to 90%. And from the very beginning, Governor Abbott was against the program for many reasons, including that he was convinced that over time, the federal government would pay less and less of the cost.
Meaning that states like Texas or wherever who buy into this system will have to use more and more of their state budgets to pay for the Medicaid that will now be mandated from the federal government.
All these years later, though, the feds still pay 90%. Participating states pay 10%. A nonpartisan Texas analytics firm predicted that by not opting in, this state was losing out on $90 billion in federal health care funding over 10 years. They also estimated that Medicaid expansion would have made Texans healthier and more productive and would have created 350,000 more jobs per year and $300 billion more in state economic output. Even the Bush School at Texas A&M said in 2020 this should be considered. They figured 954,000 uninsured Texans, hundreds of them in some counties, hundreds of thousands in others, would get insurance coverage if Texas participated, and it's estimated that would save the state $5.5 billion a year in uncompensated care racked up when those uninsured Texans go to the hospital, but they can't pay the bill. Beto O'Rourke says opting in would help Texans and Texas.
Let's expand Medicaid. We'll go from a state that's the least insured to one where everyone can see a doctor. It will also reduce our property taxes because right now you are on the hook for uncompensated indigent care.
If the outcome of the gubernatorial election next month doesn't change the Medicaid expansion policy here, next year's legislature could change it. This got a lot of bipartisan support the last time around, just not enough from leadership to push it through. We'll keep you updated and right on the money.